This is Dr. Batal. We're discussing why we do liposuction differently. We do it differently because we understand how liposuction works. We do high volume infiltration of tumescent fluid, which is essential to suspend the fat cells into a liquid, which will make it very easy for it to be suctioned and detached from the surrounding structures. Failure to do so with low volume infiltration, which is often done by surgeons, will result in suboptimal liposuction. No matter how much you try, if the fat is not well irrigated, you cannot suction at all. We use blunt, straight and curved cannula, which will help crisscross the harvest lines from multiple directions, balanced with number of incisions needed. We use a combination of technique, laser lipo, power assisted lipo, vaser ultrasonic lipo, in combinations to produce the maximum result based on the patient needs. I use a modified version of the tumescent fluid, lowering the concentration of local anesthetics, doubling or tripling the concentration of the vasoconstrictors, epinephrine, which will allow me to give higher dose of fluid, which will help further suspend the fat and give much more optimal and high defined liposuction area. We use very deep liposuction close to the fascia level, which will help create the shapes. We do superficial liposuction in certain areas to produce the high definition area along the abs, in the midlines, the V-lines, and other areas. After we finish the liposuction, we do a leveling technique, which will help minimize any dips and bumps after the liposuction. We use intravenous sedation as light, moderate or deep, depend on the patient's preference. I cannot leave the patient without have an optimal result. And finally, we take our time. Liposuction is very tedious, labor-intensive operation, and my work ethics does not allow me to leave the room without doing my best in each areas. For all those reasons, I invite you to take a look at my work and call us if you need any help.